Intersection syndrome. Intersection syndrome is a condition that involves inflammation of the tendons in the forearm where the abductor pollicis longus (APL) and extensor pollicis brevis (EPB) tendons intersect with the extensor carpi radialis longus (ECRL) and extensor carpi radialis brevis (ECRB) tendons. It is sometimes referred to as Orsman's wrist or crossover syndrome because it commonly affects individuals involved in activities requiring repetitive wrist and forearm motions. Anatomy involved. The inflammation occurs in the dorsal back part of the forearm, about 4 to 6 centimeters proximal, closer to the elbow to the wrist joint. The APL and EPB tendons, responsible for thumb movement, cross over the ECRL and ECRB tendons, responsible for wrist extension and radial deviation, at this point, hence the name intersection. Etiology causes. Intersection syndrome is caused by repetitive wrist and forearm movements that stress the tendons at the point of intersection. The repetitive friction between these tendons can lead to inflammation, swelling, and pain. Common causes include overuse from sports like rowing, skiing, weightlifting, or racket sports. Occupational activities that involve frequent wrist extension and flexion, such as using a screwdriver or hammer. Repetitive strain injuries from everyday tasks like typing, knitting, or other hand-intensive activities. Clinical presentation. Pain. Patients experience pain on the dorsal radial side of the forearm, about 4 to 6 centimeters above the wrist joint, which is distinct from the more distal pain in de Quervain syndrome. The pain may be dull or sharp and often worsens with activity. Swelling. Swelling may be visible or palpable over the point of tendon intersection. Crepitus, a characteristic creaking or grinding sensation. Crepitus may be felt or heard when the tendons move during wrist or finger extension, especially with forearm activities like lifting or gripping. Tenderness, palpation of the affected area elicits tenderness. Diagnosis. The diagnosis of intersection syndrome is primarily clinical, based on the patient's history and physical examination. Key diagnostic maneuvers include 1. Palpation. Tenderness can be detected by palpating the area where the APL and EPB cross the ECRL and ECRB tendons, about 4 to 6 centimeters proximal to the wrist joint. 2. Crepitus test. The examiner can ask the patient to actively flex and extend their wrist while palpating the dorsal forearm. A gritty, creaking sensation may be felt as the tendons rub against each other. 3. Differentiating from de Quervain syndrome. Pain in intersection syndrome is located higher on the forearm than in de Quervain syndrome, which affects the radial side of the wrist, closer to the thumb. The Finkelstein test will typically be negative in intersection syndrome, as the APL and EPB tendons are irritated where they cross over the ECRL and ECRB tendons, not at the wrist. 4. Imaging studies, when needed. Ultrasound can reveal fluid accumulation or tendon thickening in the area of intersection. MRI may show inflammation or thickening of the tendon sheaths, particularly when distinguishing intersection syndrome from other soft tissue pathologies like tendinitis or tenosynovitis. Differential diagnosis. Intersection syndrome can sometimes be confused with other conditions involving wrist pain. Some key differential diagnoses include de Quervain syndrome. Pain in de Quervain is more distal, near the base of the thumb, while intersection syndrome pain is more proximal, higher up the forearm. Extensor tendinitis. Inflammation of the extensor tendons, not at the intersection, can present similarly but lacks the characteristic crepitus of intersection syndrome. Radial nerve entrapment, Wartenberg syndrome. This causes numbness or tingling along the radial nerve, but does not involve the inflammatory crepitus typical of intersection syndrome. Treatment. Treatment for intersection syndrome is generally conservative and aimed at reducing inflammation and addressing the underlying cause, typically repetitive motions. Treatment options include 1. Rest and activity modification. Avoidance of aggravating activities, such as rowing, lifting, or repetitive wrist extension, is essential to allow the inflammation to subside. Temporarily modify work or recreational activities that involve wrist and forearm strain. 2. Immobilization, splinting. A wrist splint may be used to limit wrist motion and reduce stress on the inflamed tendons. A thumb spica splint is commonly used, similar to the treatment for de Quervain syndrome. Duration. Immobilization is typically recommended for 1 to 3 weeks, depending on the severity of symptoms. 3. Anti-inflammatory medications. NSAIDs, nonsteroidal anti-inflammatory drugs, like ibuprofen or naproxen can help reduce pain and inflammation. Topical NSAIDs or anti-inflammatory creams may also provide localized relief. 4. Physical therapy. Stretching exercises. Once acute symptoms subside, gentle stretching exercises for the wrist and forearm can help improve flexibility and reduce tension in the affected tendons. Strengthening exercises. Strengthening the muscles of the forearm, wrist, and hand can help prevent future overuse injuries. Ergonomic adjustments. Modifying the patient's workspace or posture to reduce strain on the wrist and forearm during repetitive tasks. 5. Corticosteroid injections. For more severe cases, a corticosteroid injection may be administered into the affected area to reduce inflammation and relieve pain. This is typically reserved for cases that do not respond to conservative measures. 6. Surgical treatment. Surgical intervention is rarely needed, but in chronic or recurrent cases, surgery may be performed to release the tendons and reduce friction at the site of intersection. This is usually only considered after failure of several months of conservative treatment. Prognosis. The prognosis for intersection syndrome is generally good with conservative treatment. Most patients recover fully after a period of rest, immobilization, and rehabilitation exercises. Recurrences can occur if the patient returns too quickly to the activities that originally caused the condition. Prevention. Avoid repetitive strain. If you are prone to wrist or forearm overuse due to sports or occupational activities, it's important to take frequent breaks and avoid repetitive motions. Strengthening and flexibility. Regular forearm and wrist stretching exercises, as well as strengthening programs, can help prevent future episodes by improving tendon resilience. Proper technique. Ensuring proper ergonomic technique during activities like lifting, rowing, or typing can reduce the risk of developing this condition.